To learn and share. I'll be sharing these fantastic HR voices who have come from far to join us today, this morning, to discuss on the topic HR's role in building a tech-savvy workforce for the Nigeria's healthcare sector. Without further ado, we would like to go straight into introductions. My name is Vivian Okoye for Regenesis Business School, and I'll be your host today. And the spotlight goes to Ijoma Oyeyinka. Ijoma currently is the head of human resources at Helium Health. Throughout her career, she has worked on people strategy, strategic human resource management, talent management, learning and development, and organizational transformation. She started with a degree in mechanical engineering before moving to management consulting. In her words, I switched because I wanted to build people, build systems, and build models that work. On her current role, she's building a workforce of diverse and brilliant individuals, accessing an ecosystem of talent in West, East, North Africa, Europe, and the US. She's bringing together people with a perfect mix of talent, passion, and boldness to take the challenge in healthcare head on. She previously worked as head talent management at Troika, Nigeria, and worked in management consulting with Philips Consulting, one of Nigeria's leading business and management consulting firms. Welcome, Ijoma. Okay, moving on, we've got Timothy Akinduro. Timothy is currently the senior HR executive at HCI Healthcare Limited. He is an associate member of the Chartered Institute of Personnel Management of Nigeria and a seasoned HR executive who operates at the intersection of human capital strategy and data analytics. He brings a unique blend of people-centered leadership and technical fluency, including expertise in AI applications to drive measurable outcomes in organizations. He holds a BTech in statistics from the Federal University of Technology at Korea and is currently an MBA candidate, further sharpening his strategic perspective and leadership capacity in today's complex business landscape. Beyond his professional accomplishments, Timothy is a passionate advocate for lifelong learning, deeply committed to mentoring emerging leaders and promoting a culture of ethical, value-driven leadership. He is also the author of Teach Like a Pro, a classic guide on effective teaching delivery. With this strong academic foundation and a forward-thinking approach to digital transformation, he stands out as a strategic leader in the evolving world of work. Welcome, Timothy.
Thank you.
You're welcome. Pleasure. Well, moving on, we've got Adeswa Okipo, currently head of human resources and admin at Hajia HMO. She's an accomplished human resources leader with over 19 years of cross-industry experience, specializing in aligning HR strategies with organizational goals to foster business growth. With a proven track record in strategic HR planning, talent management, and leadership development, she excels at building high-performing teams and cultivating workplace cultures that drive success. Her experience spans across banking, telecommunications, fintech, and health insurance. Adeswa holds a BSc in business management and an MBA from Nexford University and is a member of the Chartered Institute of Personnel Management. Welcome, Adeswa.
Thank you very much.
Okay, great. We'll go right into the discussion of today. Welcome, everyone, once again. So my first question goes to Timothy. Are you ready for us? You're muted, please. You're muted.
Yes, okay. Yes, let's go. Yes,
okay. All right, awesome. Can you please tell us what role do mentorship or peer learning programs play in digital capacity building in your organization?
Yeah, thank you, Vivian. Really, mentorship and peer learning are a bedrock for any organization that is serious digitally, any organization that wants to embrace in totality the digital transformation experience and the roles this mentorship and peer learning plays is just beyond skills transfer, but also cultural acceptance of these technologies. In HCI, we've adopted several approaches towards building digital capacity. And several approaches we've taken includes reverse mentoring, digital championship program, leadership series, company-wide learning initiatives, and we have seen results across these areas. For example, in our digital transformation program, we have adopted champions. That is, we identify champions from different departments, people who are comfortable using tech, people who are comfortable using digital tools. We have identified them, and as well, we have saddled them officially with the responsibility of supporting their colleagues so that they have a seamless experience when they are utilizing these technical tools. Also, we do reverse mentoring. I have been in situations whereby I have been paired up with senior executives, very, very senior executives, just to help them navigate platforms, just to help them have a good or seamless experience while using these text tools. Aside reverse mentoring now, we have also adopted a more inclusive approach of doing an organizational-wide initiative where we organize sessions periodically for people to learn and come to speak with the technology we are bringing. For example, there are moments whereby we have organized cybersecurity trainings just to proactively put the organization in shape. We have also adopted leadership series, and this leadership series will be a community of emerging leaders as well as succession plans, whereby we do not just talk about reskilling and upskilling of leadership skill, but also adopting technologies. So when we talk about mentorship and peer learning, we are seeing success in these areas with all these focus we do in HCI, like digital championship program, reverse mentoring programs, company-wide learning initiatives, and leadership series. Really, it's more than skill transfer. It's also about adopting these technologies in our culture. Thank you.
Thank you very much, Timothy, for such great insights. But I'd just like to confirm, right? You mentioned that some of this, what I call it, tools or the programs that you currently run has brought about some positive results, if I may ask, right?
Yes, definitely.
Okay, so can you please tell us how? Okay, for instance, you said you had the opportunity of, helping very senior of execs. How did you feel, having to teach them how to use digital tools? Were they kind of laid back? Did they feel very reluctant?
So maybe I should say I'm privileged to work with these open-minded people who recognize that they don't know all, and people recognize that these young chaps have something to offer. As well, they have to be emotional intelligence at play to make sure that you are delivering whatever they want you to deliver with kind of emotion, respect, and open-minded for them to come up to speed with what they're trying to make them achieve. However, I feel good because at the same time they bring their experience to bear while I bring my technical capacity to bear on the same table. So I feel good doing that, and they also feel good as well, and it's a win-win for both of us.
Awesome. Thank you so much, Timothy. Moving on, I'd like to throw my spotlight again to Adesua. Adesua, can you please tell us what digital competencies do you believe are most critical for today's healthcare workers in Nigeria today?
All right, thank you, Vivian. I would say that digital competencies are not just optional, but they are actually essential. And so if we look at the health space, one of the digital competencies that I would say is very important is EMR. And by EMR, I mean electronic medical record system. Today, you go into the hospitals and then we expect, or rather what we see is that doctors, nurses, administrative assistants, and support staff, They are able to do patient documentation through EMRs. They are able to access patients' history through EMR. So I would say electronic medical record system is very important. And one thing it does is that it helps with clinical efficiency. Another digital competency will be telemedicine. Post-COVID, what we have seen is that people can actually access care from doctors remotely. So from the comfort of your home, your workplace, wherever you are, you're able to have doctor's consultations, you're able to speak to a doctor. So access to virtual tools like telemedicine is actually a very important digital competency. And that's actually offered by my organization, Hygia HMO. One of our services, or one of the services we provide, is telemedicine. Another would be data literacy, ensuring that healthcare staff are able to understand data and interpret data. Because what this helps is that it helps with informed decision making, that they are able to look at a dashboard and look at a series of data and be able to interpret what those data mean and how they can then take informed decisions. Another would then be collaboration tools. So when I say collaboration tools, probably think about Microsoft Teams, where irrespective of where you are, so for an organization that probably has staff in a number of locations, everybody's able to come together, they're able to interact, they're able to share information through Microsoft Teams. But then we then look at potential risk as well. So I would say another digital tool would be information on cyber awareness. So when you talk digital tools, there's also the risk of cyber threats. So it's important that healthcare professionals are trained on cyber awareness, how to secure communication and how to, protect themselves from hazards as well as cyber threats. So that would be my top 5 digital competencies.
Thank you, Adesua. Nice to know that Hygia is actually doing telemedicine. I would like to come to that actually. So to what extent do you think telemedicine is being embraced by members of the public?
Okay, so today what we do at Hygia HMO is that we have telemedicine bundled into some of our plans. So that has actually increased awareness. So for instance, we have an organization reach out to us to say, would like for Hygia to be our HMO provider. Depending on the plan you have telemedicine access on it. And oftentimes when organizations have HMO service, they don't really know everything it covers. So one of the things we do on our own side is that we do how the scheme works. So when you get onboarded into our plan, we actually come to your organization and we take you through how the scheme works. So we actually tell you everything that you need to do. In the course of that conversation, we're able to tell you about telemedicine and what you stand to gain. And it's really a catch because, what COVID taught us, what COVID was able to tell us was that you don't have to be there in person to see a doctor. You don't have to be there in person to talk to a therapist. From the comfort of I'm in the office now, I could have a conversation with a doctor. I could have a doctor's consultation to say, okay, this is what I'm experiencing. How do I go about this? What do I need to do? You don't really have to be in the office anymore. And that's quite a sell, is quite a catch. And first of all, it's the comfort that comes with it. The fact that you really don't have to go in is actually is the top sell for that. So how the scheme works helps us to pass that information to release, and that has really helped us.
Great.
And I would say, yes, I would say people are really embracing it. And initially, when it was new, people were skeptical about it. But of course, when COVID happened, people had no choice and they can actually see the benefit and actually leveraging on it.
Awesome.
Thank you.
Great. Thank you so much, Adesua. Okay. Ijoma, can you please tell us what strategies have worked for you in overcoming resistance to digital adoption among staff?
Okay, so I'm going to be talking from 2 points of view. The reason being, Helium Health is a health tech. And funny enough, that Adesua mentioned EMR. One of the things we offer is EMR. We sell EMR to hospitals, right? So we are a product-based company. We build the products that we sell to other people. So I would say that most of my workforce are what I call digital natives. So these are people who are already used to it. We build the tech. So when it comes to digital adoption, it's not really a challenge for us. So I would answer that question from the point of view of newer initiatives kind of adoption, one. And then I'll also answer it from the point of view of the healthcare providers that we service, right? Part of the challenges we face when we go to deploy our EMR is actual adoption. I'm talking of we are able to deploy our products in hospitals, labs, and things like that. And one of the biggest challenges we've always faced is the adoption of the product. And so when it comes to overcoming that resistance, one of the things that we are able to recommend to hospitals, or we've been able to do, right, is to start with champions. So there's a tendency for you to want to say, okay, make it a mandate it, right? Force it, everybody should do it and things like that. But if you're looking at a nurse, registered nurse, who has 35 years experience, she's used to paper, she's used to things like that. You come, this is a well-experienced person. She knows her stuff, right? And then you now start frustrating her with one complex-looking platform with many buttons and things like that. How do you do it? Yes, most of the times when we go to deploy, the mandate to deploy comes from the top. It comes from the MDs or the owners of the business, because they know that these things will help the business to be more effective. But what we realize is, yes, they will bring that mandate. They will talk to everybody, have meetings. This is what we are doing. This is how things are going to be. But the mandate most times are not enough. And if the actual users of the systems don't use the system, or they get frustrated by it, they will always go back to what they are comfortable with. So one of the things that we found out that really helps is that we have champions. More often than not, you make sure that you have at least one person who kind of really knows the system. The reason why that's important is when Helium Health leaves, after we're done with our deployment and our training, and you are trying to onboard a new patient and you're getting frustrated, they might not know, they might not remember our support channels, or they might not know to go to the help desk part of our system. So what they typically will do is they should go to the champions. So one of the things I know works anywhere, whatever kind of product you're trying to adopt, if you're trying to go through a digital transformation in your organization, always have champions that are staff, that are easily accessible, to other people, right? The bigger picture is getting people to see the benefits of it. Of course, people know that once you get into a system, your life is 10 times easier than going to try and reference to look for papers. And I'm using my product as an example. So getting people to see the bigger picture is also very, very important. And you'd see that I'm shying away from training, not because training doesn't work, but another thing I've realized is, if you train people, but you don't embed opportunities for people to use these things on day to day, they most times will forget what you've trained them on. So another thing that we recommend is you have to make it part of your day-to-day processes, right? So now I'll come to Helium Health. When AI became a thing, and there was the whole buzz, that's like 3 years ago, with AI, we started seeing different products pop up. Aside the generative AIs, we start seeing other mini products like meeting recorders, things that summarize, things that analyze, right? One of the things that we started encouraging people is to get it to be part of your day-to-day. So where we would have initially maybe recorded a Zoom call and asked people to go back and reference the Zoom call, what would then happen is we'll make sure that one person at least has a reading notes AI in the meeting that would send the recap of the meeting and the action points to everybody. And these tools have actually improved over time. Granted, when it first started, we used to say a lot of rubbish, but the tools have improved over time. So now I'm bringing it to Helium, and I'm talking from the point of view of more cutting edge technologies that are being released every day. Like every other day, someone still sent me one this morning. My CEO still sent me another one this morning that was going to help our recruitment process. Funny enough, it's also an AI that scars the internet and gives you exactly who you're looking for. That would already cut my recruitment time. By the time I brought it to my recruitment team, they were like, "Ijoma, we already started using it." I'm like, "That's what I want to hear." So what you want to do is you want to encourage people to put it in your day to day. I've not needed to do an AI training per se, but what I've done is I try to pull it out from people and I expect people to say, okay, how did you improve this process using AI? So you lay that demand on people. So that's one way to help overcome the resistance, right, to digital adoption. You make sure it's embedded in your, end-to-end process. So I think I'll leave those 3-4 points.
Okay, thank you very much for such great insights. I have two questions for you, though. I just want to more or less ask because you said so much. So one,
Yeah.
right? Being in the tech space, for the healthcare, how do you handle the constant changes in health technology? How?
That's a good one. You have to be at the, how will I put it? So the first thing is, when it comes to the information that is available. Now, Timothy also mentioned something. I don't know if it was you or Timothy. Someone mentioned it where, okay, I think it was Adeswa, where it's one thing to look at the data, it's another thing to get insight from the data, right? So we have access to a lot of information, but you always need to keep trying to understand what is this information telling you? What is it predicting, right? You have to be where the latest info is. So what happens is, even from our product teams, our tech teams, they are in forums, they're in discussions where stuff is being spoken about, where the crazy things that people are using AI to do is being spoken of. So what you want to do is you never want to be caught unawares. In fact, when there's a new product that comes up, we might not have built it, but we would have known that someone somewhere like this was already building things like that. So I would say it's one thing to access information you have, and the world of today, the internet of today there's an overabundance of information. But what you need to constantly be looking for is the insight. I always recommend to my people to follow some certain set of people in your own industry. Once you see that this particular person is a subject matter expert that has a trend of always releasing information that gets you to think, that gives you that insight, go and, in other words, follow who know road. So you're going to want to follow that kind of person so that you can keep having conversations, discussing. Another thing is like that, discussing the same forums. The people that we are in meeting with, and it starts even with our CEO, like our product team, the other partners that we are always meeting with, just by way of discussing, right? You begin to know things that are coming up. And then lastly, you also want to listen to what your market is saying. Some of the things that the market begins to demand, right, will give you insight as to what will be produced in the next couple of years. I remember before telemedicine was a thing, before COVID, there was some buzzword. In fact, with the African market, specifically Nigeria, then the reason why telemedicine was being pushed was because people kept trying to solve the problem that how do you scale healthcare reaching people? We are over 200 million. We have limited doctors, and I'll say the years 2020 to date have been our biggest years of brain drain when it comes to medical professionals. So we already had few doctors. The few doctors we had stayed going out. So we had a problem where you needed to be able to scale medical healthcare services, and telemedicine. We had already started talking about telemedicine as far back as 2019, because we were looking at it as an opportunity to scale, where a doctor in Lagos can see patients in up north, where the ratio of doctors to patients was very high, right? So you also need to listen to the markets, listen to what people are demanding. That would already begin to tell you. For example, another thing that the market is saying now is talking about using AI for diagnosis, or using AI for, I forget the medical technology, I think it's called triaging, right? At least the first level review of patients before they go to see the more people. What you want to use them to do is to just classify who they should be seeing. And for you to be able to do that, you need to train AI with our actual data to be able to diagnose properly. So that's what the market is saying already. So we're already in that. We're already building our own care co-pilots, right? That's what we call it. We have a product that we are building that is already AI enabled that will help healthcare professionals to diagnose faster. And the reason is because in Africa, what our market is saying specifically is we still have a large number of people. We have limited doctors. The pool of doctors we have keeps shrinking every day. And we need to give more people access to information. Yes, so that's what I'll say.
Thank you very much. Thank you so much. One more, like I told you, you talked about champions, right? How you try to identify champions when you go to hospitals. So what other methods would you apply to encourage that adoption? Because if you don't now get champions, I mean, what else do you think would help?
Okay, so from the point of view of the hospital, like I said, the mandate usually comes from the top. The person who owns the hospital or maybe the MD or whoever has taken over. What we always do is when we go and deploy, we don't leave the hospital without training. So even if what we try to do is in the training, we try to identify the champion and not just one person, like multiple people. Where we see that there is no champion, one of the things we recommend to those hospitals, and it's funny the topic for the for this overall session, which is what is happening within the ecosystem in Nigeria and digital healthcare. One of the things we try to recommend is for them to get someone that is knowledgeable with IT skills. At least you need to have that one person. So if there's no internal champion, right, we are able to like provide we have partners like outsourced staff that we can give them as options to say, okay, these guys can stay with you for a period of time till you guys get used to it. And the reason is because most of the resources that will help them to get better with the system is also digital as well, right? So it's not as if we give them manuals, physical manuals. We have help centers, we have videos, but the videos are digital. So you need to be able to use a computer to watch the video. So that physical point of contact is still important because most times where the gap is not just that they don't know how to use the system, is that some of them, their gap starts from even understanding how to put on a laptop. And I kid you not, right? You put on a laptop, you notice that my EMR is not working. No, you're not connected to the internet, right? Something as basic as that. And I'm thinking, think outside Lagos, think outside your familiar environment. So that's why I call you to your digital native, because a digital native is not just a young person. Digital native is someone who kind of naturally knows what to do when they see a digital product. So you already know, okay, there should be a start button, there should be a login, username, password. Somebody can call our help desk and be saying, what's my password? We can't know your password, right? So what we try to do, aside identifying internal champions, is we also recommend where we see there's none. We recommend, we have partners that we can recommend to say, okay, you can bring this person on board as an outsourced staff, just pay the person for a couple of months to make sure the person sits with you, because we find out that some of the issues that they diagnose might not even, most times has nothing to do with our system. It's working perfectly. It might be internet issues, it might be light issues, it might be login issues, it might be I've forgotten my password kind of issue. So you kind of need like an IT resource. And when you really think about it, most hospitals have doctors, nurses, admin, they have cleaners, but they don't have IT people. It's not a job that they typically would put in there, but you can't adopt digital products if you don't have an IT person there to help you. So that's that's another thing that we recommend, and I know that helps.
Thank you. Thank you so much. We have Tia Yossi who has joined us. Tia Yossi, are you there, please? Very quickly. Are you still in on the call? Or have we lost her again? I'm not sure. Maybe we've lost her. Sorry about that, guys. Okay, so my question.
I've been here since I didn't just join.
Oh, okay.
I've been here since you started the introduction, yes.
Oh my goodness, my apologies. Please,
Fine,
I'm so
that's
sorry.
fine.
Okay, I'll just go straight into introductions. I want to introduce you very quickly and then ask you 1 or 2 questions. Okay, so we've got Tia Yossi Femi Raji, who's currently in on the call. She's the group head human resources at Afia Care Limited. She's an experienced professional with a strong background in human resources and organizational leadership. She holds a BSc in accounting from Madonna University and is an associate member of the Chartered Institute of Personnel Development, CIPD, as well as a fellow of the Institute of Management Consulting. With over 15 years of experience, TAOC has built a reputation for driving organizational growth through strategic talent acquisition, employee engagement, and workforce development. She has held key roles at Access Bank and CC Trust Holdings, where she played a pivotal role in shaping HR policies and cultivating a progressive workplace culture. In her current role, she leads HR transformation initiatives and champions employee-centric strategies that support the company's broader mission in the healthcare sector. Welcome to AOC. We're so sorry.
It's fine.
Okay, so your first question, please. How do you encourage intergenerational collaboration between tech-savvy younger staff and more experienced professionals in your organization, please?
Thank you so much, and thank you for everybody. I've been listening in. So I just started here listening, and I was enjoying the session. So kudos to Adesua, Ijoma, and Timothy. I mean, you guys kept me captivated because I was saying, since you didn't introduce me, maybe I should take I should leave. But when Timothy started and then Adesua spoke and Ijoma spoke, I said, okay, no, this is a very good session. So well done to everybody that's spoken so far. I mean, I'll just piggyback off what Timothy started with, reverse mentoring. So that's one of the things that we do. You know, when you do reverse mentoring for younger generations, things are changing now. The workplace is changing. Everything has changed. What we know to be normal is no longer normal. I think Ijoma mentioned it, even Adesua mentioned it, that COVID has changed everything. So it means that, so why I was just enjoying it was because it means that what people say is normal, what people say can't be done, now can be done. So reverse mentoring, people come in and it's no longer the older generation mentoring the younger ones. It's about the younger ones now mentoring the older ones that, okay, this is how you should do. You know, before when you started a career, it was more like everybody, when they yell at you, you say, oh, we're sorry, sir, this is what we do. Now it's about you being very cautious. There's something about mental health. Even we ourselves, we need to be very cautious because our mental health too is very important. So we do reverse mentoring. And I mean, cross-functional projects, you know, I mean, you're having projects across functions. So sometimes we look at it that, oh, there's a project to be done. Why don't you join this team in doing that? And those things help the younger generation because what they want is that they're very restless. They're in a place where things are moving very fast. The place is very agile. Yesterday is gone. We're looking into future. I was hearing when Ijoma was talking about using AI to do recruitment, and I was like, God, things are really changing. There's a lot of disruption. So talking about having cross-functional projects, putting younger people into projects that have nothing to do with them. So there's a project, you're saying, you're a young staff, why don't you join this project? And it helps them open up their minds and helps them even learn across functions. Because one of the things I've noticed is that this Gen Z, or as we call them, or the younger generation, they usually get bored. It's not like us that we started a career, I've been doing HR for 18 years now, and I'm still doing this HR. This HR is where we'll die. You know, they are bored. After a while, they're like, what is this? What is in it for me? Why can't I go and do this? So giving them projects type of things would help them. And equally, in terms of the training, having training, so, you know, training helps in a long way. And then doing digital training for this young generation would help them, you know that at least the workplace is changing. Classroom training is good, but having them, you know, do trainings that have to do with on the digital part of it goes a very, very long way. And equally, a culture of, you know, I spoke a bit about it, of inclusion and mutual respect. When I started, I talked about how young people now look at it that when you yell at the workplace, it's no longer you, you know, when I started my career, if you yell, well, we're very sorry, forgive us. Now you are looking at it like, no, you don't have to do that. Having mutual respect at the workplace. So all these are some of the things that would help this younger generation to have this intergenerational collaboration.
Thank you so much, Yossi. I appreciate that. So, but I would like to just ask one question, right?
Yes.
From what you talked about, reverse mentoring, what are the challenges that you've noticed while adopting that?
I mean, one of the challenges I noticed is, for me, when I have young generation, is for them to even be able to understand you. So that understanding, so they are saying theirs, we are saying ours, and connecting with them. So when you give them kind of examples of, oh, this I didn't just get here by happenstance. They're like, no, I don't know what you're talking about. I have a case of where the young people in the workforce that we just recruited, they're called management trainees. When they come in, they're deployed to work in different areas. So they're having issues. I don't want to do this. This is what I read in school. And I'm saying, no, you can. It's not, someone here is a mechanical engineer and the person is doing HR. You don't have to always start with what you read in school, Why don't you just try it out? And they're like, no, I don't want to do it. I don't understand. It's easy for you to say. And I'm saying, no, it's not easy for me to say. Yes, we're in a Gen Z generation, but it is really the millennials that are running this workforce. So getting them to understand and buy into your thing is really very difficult because everything, when you're explaining to them, they look like they kind of see it as if you are saying it because it's convenient for you. They're not seeing it from their own angle. But, so that kind of thing, that gap is usually very difficult breaking into them, making them understand that, the career is something you can build at any particular point in time. So that's really one of the biggest challenges I have, having them to understand that whatever you are doing, you have to put in your best, and this is the world of work. And although you are Gen Z, you are working with millennials, which means that there has to be a bridge. But they are saying, no, I am Gen Z. This is how I think it should be. If you say my work is 9 to 5, 8 to 5, it's 8 to 5. Why are you calling me at 6? Why are you calling me at 7? I don't want to do that. But I'm saying, at the end of the day, this work has to get done. The people you are serving, the customers you are serving is like, I'm in the healthcare space. The customers you are serving work 24 hours. So you can't tell me, oh, you are going to sleep, those kind of things. So these are really some of the issues we have.
Thank you so much. Okay, I think Olakule is also in on the call. Kule, can you hear me?
Yes, I can hear you. Confirm you can hear me too.
Yes, but we can't see you. Please turn on your camera so I can do a quick introduction.
Okay, how about now? Can you see me?
No, we can't see you. Okay, yes, we can. Yes. Thank you. So currently, Olakule Tijani is the head of Total Rewards and Corporate Services at Emzo Pharmaceutical Industries Limited. He is a senior HR and finance professional with over 18 years experience in human resources, total rewards, compensation and benefits, payroll administration, and corporate services, management across multiple industries, including the banking sector and the pharmaceuticals. He has a strong background in HR strategy, financial planning, compliance, process optimization, and digital transformation, ensuring efficiency, cost savings, and regulatory compliance in HR operations, with a BSc in accountancy from Enugu State University of Science and Technology, and an MBA in financial management and certifications in HR, such as the ACIPM, the FCIHRM, and CHRC, finance, and as well as supply chain management. Olakule combines business acumen, analytical skills, and leadership expertise to drive impactful organizational change. Welcome once again, Tijani. Are you there, please? Hello? Can you hear us?
Thank you for having me.
Okay, all right. So quick one. What metrics or
Yes, I am.
What metrics or KPIs do you use to measure progress in building a tech savvy?
I can hear you.
I can hear you, Kunle. Can you hear me? Can you hear me, please?
Yes, I can.
Okay, so I just asked this question. What metrics or KPIs do you use to measure progress in building a tech savvy workforce in your organization? I think we're losing you. Tijani, we're losing you. Okay, so I think we'll just move on. Let me move on to Timothy. Timothy, are you there?
I'm here.
Okay.
Can you hear me? I'm here.
Yes, please, we can. So Timothy, please, can you tell us, are you seeing a shift in the kind of healthcare talent you recruit today compared to 5 years ago?
Yes, thank you very much, Vivian. Definitely yes, really definitely yes. Just like Ijoma said, and just like Tia said, COVID changed every single thing. 5 years ago, 2020, pre-COVID, 2025 are just 2 words apart. In the year 2020 and before the year 2020s, emphasis have always been on your certifications, your clinical certifications, your years of experience. But this 2025, even though those are still baselines, but emphasis are not just on those criteria. I mean, they are the qualification or the entry point dynamics has expanded. Right now, we are having to deal with emerging roles. Right now, we are having to deal with having technical fluency just as the baseline. So many things changed. First, let me talk about the technical fluency as a baseline for our recruitment. Now, people are coming in. We are already assessing them by their usage of meeting tools like this. And really, I remember sitting on a particular panel recently, and this particular candidate was struggling with meeting tool, and it looked like not just a normal glitch that everybody experiences. It looks like something that is personal to her, something. And really, it significantly affected her performance and her perception with us. And this kind of cognizance wouldn't have been necessary some 5 years ago. But now it's necessary. We are assessing people not just on the competence they are coming to deliver for us, but also on these basic things that we are expecting them to do naturally. So aside having to assess people by their technical fluency, also we have experienced roles changed, evolving roles, new roles like clinical data analysts. We are not in vogue, we are not in demand 5 years ago, but now it's everywhere. CRM developers, telemedicine coordinators, system administrators. These roles are not roles that are typical of an healthcare sector those days, but now they are in vogue, they are in demand. So definitely, there is a shift. And those days too, we recruit university graduates, polytechnic graduates, but now our pipelines have extended to boot camps. I mean, coding boot camps. People who are not even BSc holders, we start going to those places, go to health institutions to go get talents for ourselves. So many things have been disrupted, and really, at this year, we have made peace with that it is no longer business as usual. We have evolved, and we must flow with what is on in this world. So the recruitment landscape and the recruitment process are evolved. That's changed drastically to what it has been in the last 5 years. Now we prioritize how adaptable a candidate will be, how adaptable our talents are. We want to see that you are comfortable with lifelong learning. We want to see that you have that agile mindset. We want to see that you can learn. We want to see that you are fluent technically. We want to see that you are able to work within teams. You are able to catch the flow. You are not laid back. So what we are looking for now is potential, adaptability, technical fluency compared to those days where technical fluency are just nice to have things that they are not important. Right now, they are important. So there is a change, not just a massive change to what we had in the last 5 years.
Thank you so much, Timothy. That's what we call disruption, right? We're receiving changes every day. Okay, so Tijani, are you ready for us? Are you there? Is your network okay right now so that you can answer the question?
Okay, so is it better now?
Yes, please. But we can still see you. Can you please turn on your camera?
Okay. I think it's on now.
Okay, but go on. Yes. Okay, so we can see you. Okay.
Apologies.
Not a problem. Okay, so do you want me to repeat the question?
Sometimes.
So sorry.
The network can be very.
Okay, so like I said, I understand. So like I mentioned, what metrics or KPIs do you use to measure progress in building a tech-savvy workforce in your organization?
All right. So, I think your question centers around
We're losing you. Sorry, Alakule. Your network is very poor. We can't hear you. Is it possible you turn off your camera? Then maybe you can hear us. Hello, Kule.
This is right. If I hear you.
Okay, yes, it's a lot better. Thank you.
So I'll just be straight to answer I'm applauding the other panelists earlier on. And we've used both quantitative. So was basically saying that in EMSOR we use both the quantitative and the qualitative KPI that is tied to digital readiness and capacity development. And I'll just mention some few methods that we have used to measure KPIs around these digital tools in the workplace as we currently do in EMSOR. One major area is around digital training completion rates, where we try to assess the percentage of employees who complete digital training modules, especially on the human resource information system, which helps to drive compliance and remote collaboration tools. Again, we also make use of adoption rate of digital tools like the employee self-service, where you can then measure and track learning progression of every employee, and it's give you in this visualized dashboard form where you can then see the overview of percentage of people who had completed what at every different time, and at the same time use it as more like check and balance to also help drive completion rate. And in terms of requests, we had introduced something within the year, which is around Ask HR Hub, where people can then make requests seamlessly by logging into this app and turning their request. Back end, we then track the turnaround time for the completion of this request. So with the aid of this Ask HR as an app, this has also helped us to close out issues, also look at how long these issues are well closed out, right, within the set turnaround time. Then around operational efficiency, KPIs also help us to measure completion rate around major processes like time to hire, payroll accuracy, integrity check around turning out data and numbers for business decisions, and also integration of adopting this tool to drive results around majority of our HR processes. So you will then see that the goal is not just to measure adoption, but it's also to track the capabilities and translate into performance, employee engagement, and readiness for digital delivery. So these quantitative tools and qualitative tools has helped us to effectively use digital tools to measure efficiency and productivity around major of our key processes in HR operations.
Thank you very much, Kule. I just want to also confirm, okay? What do you do when completion rate is not high in terms of adopting those tech tools?
Okay, so basically what we do then is that because we've set a clear target for ourselves and the metrics in checking weekly to ensure that these completion rates are met. So in the case where we realize that there's a low turnout of completion in some of these tasks that are meant to be completed or to, so what we then do is just collate this information, we pull them down, then breaking them into decentralized form to which we can then use to run with the business leaders and the employee where they to push them to complete what they need to do. So in the case where maybe they are having some, let's say, technical issues or some things that is not helping them to complete this result, by the time we then have these metrics shared with them and we have their feedback, it also helps us to know how to help them resolve these issues timely and ensure that they complete as at when due, so that we don't then have gap in terms of communication of completion of set KPIs.
Okay. All right then, thank you so much. Oh, such great insight. Moving on, I'd like to come to Adesua. Adesua, can you please tell us how your organization currently is assessing and addressing digital skill gaps?
Okay, thank you very much, Vivian. So first of all, I would approach this question from, first of all, identifying where the gaps are. Top of mind will be communication gaps. And if you look at communication gaps, a way to address it will be Microsoft Teams, which is a collaboration tool. What this helps with is that you are able to have a wider reach in terms of audience. So an organization like mine, who has presence in 9 locations, we're able to have town hall meetings. We're able to have departmental meetings. During those meetings, we are able to exchange documents. We're able to exchange files. We're able to share screen as well. And just generally, what it does is that it makes passing information pretty easy. Apart from communication gaps, we would look at learning gaps. And when you identify learning gaps through probably skill audits, what you want to do is that you ensure that those gaps are closed as soon as possible. And so when you identify a learning gap, if you want to approach that as fast as possible, you don't want to think about learning management system. Today, there are so many of them, but we can then look at, Coursera, Udemy, LinkedIn, where employees are given access to these apps and they can quickly upskill themselves and they are able to add value. Another gap would be around, let me say, time, right? So traditionally, what used to obtain before now is that people, human resources, when wanted to run payroll, would do it manually. Excel, the computation, the statutory deductions, everything is done manually. It was time consuming, it was not error free, and it was just, it was just a whole lot of man hours being wasted. Now, with the introduction of a HRIS, you are able to run payroll more efficiently. It's error-free, the deductions are accurate, and it just generally makes everything pretty much easier and faster as well. So you're solving for time, you're solving for ensuring that you have an error-free report. Again, when you narrow it down to a HMO organization, like my organization, Hygia HMO, you have doctors, you have nurses, you have medics, and you have non-medics. And most of the tasks we do are usually time-bound. And so, for instance, you have an enrollee calling to make inquiry about something, and probably the person speaking to him is a non-medic. So the person might not have sensitive information or sensitive data that may be required. What we've done on our end is to create an automated knowledge library where, irrespective of the fact that you are a doctor or you're a nurse or you're a non-medic, you can actually refer to that knowledge library and you'll be able to give out information as and when due. So that's just it.
Great, thank you so much. So I'll just come to you once again. With reference to learning gaps, how do you monitor to ensure that employees comply to using LMS?
Okay, so first of all, we have check-ins, right? When we grant you access to the app, there's actually a time frame to say, okay, you are expected to log into this app and then complete this course probably within 1 week, 2 weeks. But as HR, we monitor from the back end. So we have mid-program check-ins. So we're checking to see, okay, are you actually progressing? How many modules have you completed? And at the end of the session, we actually do a post-training assessment. So we're able to check and see if it was beneficial and if this person has improved. But then you don't, even after the post-training assessment, we don't hands off. We actually check in with the line managers to see that there's actually been some value from that training. So we monitor from the back end.
Great, thank you so much. Okay, Ijoma, you ready for me, please? Your second question, how do you foster a culture of innovation and continuous learning in traditional healthcare environment?
Okay, so I'll lean on some of the things that Adeso has said, right? It's good to have some of all those tools just readily available and accessible for people. Because when you're thinking of a culture of learning and innovation, there's a large part of it that has to do with a person's disposition, having that, and I know other speakers have mentioned about having that teachable spirit, having that curiosity to constantly reinvent yourself. So if I'm to assume that people already have that, the next thing you want to do is make sure that all those tools are already available to them. So I'm not going to rehash some of the things she said. The only thing that I want to add is I'll say some of the things that we have done that has worked for us are things like challenges. Timothy mentioned something about going to recruit from boot camps. You can also host your own internal challenges as an organization. You can also host your own internal boot camps, right? So we've done things like that where we say you can do something like called an AI challenge, right? What that does is if you don't know about it, it forces you to go and learn. And if you've learned about it, it forces you to apply yourself, which also is a form of reinforcing what you've learned. So in addition to having all those tools and training plans and things available, what you want to do is you want to begin to generate and simulate the challenges that people will usually use these things they've learned to apply to make things happen. So that's the one thing I'll add on top of what Adeswa said, right? Have challenges. You can think about it. You can just have whatever your learning goal is or your learning strategy is as an organization. Put people in teams of 2, teams of 5, and ask them to have a challenge. Say, come up with a product, or say, solve an org-wide problem. Give them a case study, or whatever it is. Simulate that kind of thing. Have them present. Pick a winner. Again, it's a nice way, it's a gamified way of getting people to be involved, and you'll be shocked how much people learn just by interacting with other people in the organization that have also learned, and then by applying themselves. So I think those are things you can do. And here again, I'm assuming that the people you have already have that curiosity built in, because it's not something you can give. You always have to, in fact, from the recruitment point of view, you have to want to look for people like that are always curious to learn. Because trust me, we don't know what the tech ecosystem is going to look like in the next 5 years. But if you have that curiosity, we know that whatever comes out, you'll be able to quickly upskill yourself, right? And make the best of it.
Thank you. Thank you so much. Okay, Tiyeyosi, can you please tell us how do regulatory or compliance requirements impact your ability to implement tech-driven training initiatives in healthcare?
Thank you so much. A lot of the speakers have spoken about AMR and a lot of things about tech. I mean, I know regulatory compliance comes as maybe like a bottleneck. For what I know is that when you're in the healthcare space, we are very big on confidentiality. So we kind of use health regulatory compliance as a way to ensure that we better our processes. So working closely with the regulators, whether it's medical and dental or pharmacy, just to ensure that people are doing the right things, because everybody's going tech. One has to be very careful. When you're dealing with EMR, that's electronic medical records, you have to be very sure that people are not using the records for things that they are not supposed to. There's a lot of confidentiality. So it's a two-way street. You need to ensure that you are very close to the regulatory compliance. So you are not used, so that you're not liable, people don't come and sue you for things that you have done because you're not in compliance with regulation. While regulatory is good and for tech, but you need to be able to ensure that people know what it is, continue to train people, ensure that they know what it is about confidentiality, data protection. And your organization has to be very big on data protection. Everything that you need to do, you need to cross your I's and dot your T's so that you don't end up having litigation or cases or going to court because somebody is trying to sue you for doing things. So, I mean, those are the few things that I would say that would keep that regulatory part very tight. So you need to ensure that even though it's a bottleneck, you are, as an organization, using it to ensure that there's sanity within the workspace.
Thank you very much, Tiyeyosi. Olakule, I'm coming to you. How can HR leaders collaborate more effectively with IT departments and healthcare administrators?
All right. Thank you very much. I would say that even currently using my organization as an example, because we are currently driving change management around major areas of our processes, and we know we can't achieve that without having this cross-functional collaboration with the IT department and some other stakeholders that will also help us to achieve this. So I will basically speak to 3 areas, which is what we are currently doing in terms of collaboration. That's the first area is around joint workforce planning. So we had identified the fact that we need to leverage on IT and departmental heads to identify digital roles that requires competencies early in the workforce planning at the start of the year. So that also helps us to quickly identify these roles before we then start going to implement or actualize in closing up those gaps. The second area that we had effectively collaborated with IT is around digital upskilling program. Of course, we know that it's very essential for employees to also know how to make use of not only this digital tool, but use them optimally, because no matter how good these digital tools are, they are as good as the users, right? So we had co-designed digital literacy and tool-specific training for people that are non-technical and administrative staff in most of our locations in the country. What then we have also done is to set up what we call computer hubs in different locations to ensure relevance and accessibility. So you then see most of those people that are, most of those employees that are in production and some other departments to also have access to leverage on using these computers in their respective location. And another thing that has also worked for us greatly is around cross-functional committees. So at the start of we driving this change management, we have also realized that, like I earlier mentioned, that digital tool is going to be a very strong instrument for us to achieve this result. So we had to set up digital transformation working group that includes HR, because we are the drivers of process, right? And also collaborating with IT, compliance, and functional leads, depending on the areas that the focus is on. So this has also helps us to monitor progress and address integration when it comes to even challenges that we had encountered as a result of implementing these areas that we had focused on. So we then see that as HR, in collaboration with IT, we are not just translator between technology. We are not just the fact that we are just acting. We are that bridge between technology and also using that technology to get the right talent, ensuring that these digital tools align with human capabilities and business outcome. Thank you.
Thank you very much, Olakole. Moving on, coming back to you, Adeswa. Can you please tell us what are the biggest challenges you faced when upskilling existing healthcare staff?
All right, thank you, Vivian. One of them will be resistance to change. The times we are in now is a time where we are pro-automation as well as AI. And you still have people who think that AI is coming to take their job, or you have people who think that I'm quite comfortable with the traditional way I do things. I'm quite comfortable with the way I report, with the way I do my work. They're stuck in that era. And you usually see this with people who have been used to doing this for such a long time. So older employees who have been in the system for a long time. So the first challenge I would say would be resistance to change and not embracing adoption. And I'll give an example. So you can take, let's give an example of a department who does a lot of reporting, probably a department with a team of 5 who are required to churn out a report very often. But you find out that this report actually takes 5 days to generate. Now, if you introduce a data analyst into that department whose core role is data analysis, and then that person is able to churn that report out in 1 hour, what you can see is that there's an improvement. But because you actually have people who in the team, like I mentioned earlier on, are still resistant to change, they don't want to see the benefits of the change. So it takes time for you to actually begin to see adoption, for them to embrace adoption. First off, you have to do a deep dive to actually understand that there's a problem, why this report is actually taking 5 days to churn out. But by the time you actually put measures in place, you start seeing that that report can actually come out in 1 hour. So I would say there's a problem of resistance to change. There's a problem of embracing adoption. But again, when you begin to introduce these new measures, over time, after a while, they'll actually buy. You'll actually get their buying, or you actually get their support. Just along the reporting line as well is also the use of business intelligence across departments or across units to take or to make informed decisions. Now, every department actually has peculiarities that surround them. But if you then have someone who's in charge of business intelligence, the person can then, have a broad view, or just take it department by department and take a good look at it and see what information can actually come out using BI. So it's that change, is that top of mind would be that resistance to change, and then embracing adoption, and finally getting to convince them and get their buy-in. So those are the major challenges we face.
Thank you so much. That's great insight. Okay, Timothy, I'm coming to you now. How do you ensure diversity and inclusion during recruitment process?
Yeah, thank you, Vivian, for that question. Diversity, inclusion in recruitment, really, without checks, we humans are prone to biases. Yeah, without checks, we are prone to making errors that is related to biases. So there have to be conscious efforts to build diversity and inclusion into what we do, into our function station. And for recruitment, how we have been able to adopt diversity and inclusion starts from the time we are even doing the job description. We make sure that we use job description terms that are inclusive, that encourages people from different background and experiences to apply. So we start our D&I from that point. Also, when applicants begin to come in, we want to ensure that they meet with an interview panel that is also diverse, panelists that have experiences, that have backgrounds, that have different exposure, digital fluencies. We want to make sure that the panel is diverse. We want to make sure that the panelists are from different departments, different age group, diverse age group, different experiences, so that decisions is not just tilted towards one side. So we look at having a diverse interview panel. Also, we look at having a standardized assessment. There is an assessment framework we have that is very objective and brings bias almost to zero. So that assessment will be used for the applicants, just to make sure that we have a kind of diverse applicants coming in. We look at we also look at potential sometimes, not every time. We also hire for potential sometimes, instead of just donkey years of experience, so that when people are coming in, we have fresh minds with different kind of exposure, who is able to bring a fresh perspective to how things are done in-house. So I'm talking about diversity and inclusion in recruitment. We've adopted strategies around having a job description that is truly inclusive, having an interview panel that is really diverse, having a standardized assessment framework that reduces bias to almost zero, and also hiring for potentials in some cases, so that we have fresh minds bringing fresh perspectives to how things are done in house. Thank you again.
Thank you so much.
Yeah.
We've got a few more minutes before we round up. So the next questions to TAOC, we've got to, please wrap it up very quickly. TAOC, how are you using workforce data and analytics to personalize learning and development pathways for digital skill acquisition?
In the healthcare space is a bit, one of the speakers had talked about the fact that, I think it was Ijoma that said, if you said, my system is not working, it's just the fact that there's no Wi-Fi or there's no internet connectivity. It's really a whole lot, especially in the hospital that we have. So part of the things that we do is that we try and encourage digital learning. When you are coming on board, before you even get into the system, you must take the training on how to use the EMR. We try and incorporate training and digital-led trainings in our workforce, just to continue to push that narrative that everything is going digital now. Even though they are very resistant to being digital, they are, I just want to treat people. We just ensure that we have those digital-led kind of trainings. Just keep having change management to make sure that people understand what it is to be digitally led. So those are the kind of things that we do. We have our trainings that we try to incorporate digital into our trainings, make sure that people understand what it is. Before you even start work, you go through a training, and it's all digital led to help you understand what it is that is what we get, what is expected of you on the job. So these are the few things that we do at our own place at Afia Care.
Great. Thank you so much, TAOC.
Yes.
Coming to you. How are you preparing staff for technologies like AI, in diagnostics or telemedicine platforms? Ijoma.
Sorry, I didn't know I was on mute. So preparing staff for AI in diagnostics, right? Again, we already know that these things are here to stay. So what we are doing is we are trying to be at the forefront of it, if anything. So we are not preparing people, and I'm talking internally now from a HR point, from Helium point of view. What we want to be able to do is to begin to look to building those tools, or even partnering with people who are building those tools, so that we can begin to release those features on our EMR. Like I said, we already have things like that in our roadmap planned, so that people who use our EMR will soon begin to get such features, where it supports diagnostics and things like that. Now, from the hospital point of view, by the time we release such features, what we also do is we train them, because it's going to tweak their process a bit and how they work. Depending on how the tool is going to be, it's going to tweak their process. Let me give an instance. If your usual roadmap for how you handle patients is that when they register, they see a nurse first before they see a doctor, before they see this. Most times, things like that, when it comes to assistance with diagnostics, it will be on the module where the doctors are going to be filling in. So it's like a navigator, it's like a co-pilot with the doctor, where as the doctor puts in their notes, the diagnostic is helping them to check to make sure that some of those things are aligned. It's looking at the history of the patient and things like that. So from my end, we're already building tools like that. And then from the end of the people who are going to use those tools in preparation for it, there will be training, and the training will be specific for the people who are going to be using it, which will most likely be the doctors. There are also other use cases, right? That we are looking at. And like I said, unique to our African markets, we actually need it. We can't but afford to have something like that in our African ecosystem. If not, we're going to keep losing numbers. We take for granted the doctors that we have in Lagos. And guess what? Even the doctors we have in Lagos, even now your private centers, you still have a longer wait time, because you are having, on a good day, nothing less than 30 to 50 patients to one doctor in a private clinic in Lagos, right? So again, think of people who are up country. So for some of the use cases that we are thinking for tools like that, again, is to be able to, and you have to kind of, it's that telemedicine. And I like this question because AI diagnostics and telemedicine will be a very good marriage, right? Because if you have a tool that is able to help you diagnose, and then based on that, you can streamline and triage, it will give you the doctor to speak to. It helps people in places that don't have access to physical doctors to get physical doctors, right? So in preparation for that, whether we like it or not, some of the challenges we still face in Nigeria will still be those challenges, which are infrastructure challenges. But there are some products that are getting better, making it easier. By infrastructure challenges, there has to be light, there has to be internet. The solution we had to light initially is, okay, you now have power banks or solar powered devices to charge, you have inverters. But the solution to internet still stays. In Lagos, we are still having internet problem. Again, imagine up country. But with the advent of things like, I forget the name now, Elon Musk's tool that he uses for internet. I'm sure I'll remember it, or maybe Timothy can help me. I've forgotten the name. It just left my mind.
Starlink.
Starlink, yes, right. With tools like that, the actual potential for those tools is anywhere. People, as long as your Starlink can get access to a clear sky, you can get internet. So those are use cases, but those are foundations that have to be put in place in preparation. So I think we're getting there. We're getting closer to having somebody in the village, having whoever you have, your parents in the village, at least have access to diagnosis and telemedicine wherever they are. Once they have a power device, either through solar or inverter, and then they can get internet through some of these tools that give them access to internet everywhere, then by then the software part of the development, which would be the diagnostics and tools, would have caught up. Again, in Nigeria, let me not even say caught up, because there are already tools that are doing that right now. So I'm thinking of the broader picture. And then in terms of adoption, another thing that helps when you are releasing things like this is that you release them little by little. You don't come so strong, right? We believe that our clients and our doctors are in a better place to receive these products today than they were 3 years. Why? Because a lot of the buzzword has come, it's gone, people are already using it, people have seen the potential of generative AI, right? So they already are expecting it. There's a lot of talk in the ecosystem. People are seeing news outlets already sensitizing people to let them know that, oh, an AI was able to detect cancer at 96% accuracy, just using one image. So people are already kind of getting ready for it. I think if this had happened too quick, too soon, we would have been so jarred. Somebody spoke about people being afraid of how it would take their jobs, but I think because things are being released step by step, I know GPT just released another feature last week Thursday that is going to thoroughly disrupt again, but they keep doing things like that little by little. So I think we're in a good place and people are already gearing up to that because our ecosystem really needs it. Yeah.
Great. Thank you so much. Olakule, very quickly, we've got 5 more minutes to go. In what ways are digital tools transforming how HR itself operates within your organization? Very quickly, please.
All right. Thank you very much, Vivian. I love the fact that I think Adeswa was the one that mentioned major processes around how digital tools have significantly improved HR operations. And she mentioned HIRS implementation, how that has really helped transition from manual record keepings to fully digital integrated system of managing data, employee records, the use of payroll, leave administration, and performance management to improve accuracy and data integrity. And that has really, really, really helped a lot to make work not where we used to work hard, but to even work smarter than the way we used to do and have more time to do more strategic things. Then I think also one of the panelists also mentioned the use of AI around recruitment. Now in EMSO, we use application tracking system to streamline recruitment process, which then allows to post job screen resume, track candidates' progress, and also being able to manage communication. And you will see all of these things is just on one platform. So you then see that the thing that will have taken a whole lot of humans to take more time in doing something has been simplified on just one digital tool to address that. Again, another area I will speak to will be around the learning tools. We will also see that digital tools has also helped us in EMSO. E-learnings platform has greatly improved continuous learning and skill development. So you can even have access to some of these courses that is meant to upskill you through your phone. You don't even need to have a laptop. In as much you have you're a staff, you can easily get registered and have access to some of these courses that are meant to also help you in your personal development. And the last area I will also talk about, which is also not far from the HIRS application, is the employee self-service, because that platform helps staff to manage their own data. You are in charge of your data. You can make requests, approval, access to documents, and that's in one way or another helps to reduce the administrative time spent in doing or engaging HR personnel. So it majorly also helps to encourage data ownership, and again, data privacy. So in all of these 4 areas, I would say there are major areas that has helped us to improve our processes in EMSO, to be more strategic and move from being operational to transformational. Thank you.
Thank you very much. As we wrap up this session, I believe that we all have lent valuable perspectives on how digital tools are reshaping HR functions, the importance of cross-functional collaboration, and practical strategies for overcoming resistance to change. HR leaders are key to healthcare's digital shift, equipping teams for continuous innovation and intergenerational learning. Key takeaways include the need for data-driven approaches, targeted upskilling, and inclusive recruitment practices that ensure that workforce is not only digitally competent, but also diverse and future-ready. And as we wrap up, we want to say thank you on behalf of Regenesis Business School to our esteemed panelists, Olakunle, Ijoma Adeswa, Timothy, and Tiyeyosi, for sharing your expertise and insights with us today. And a very big thank you to all our audience for joining us and participating actively. It has truly made our discussions vital and impactful. But before we finally wrap up, I'd like to give each of our panelists a minute or two for final thoughts. So, Ijoma, final thoughts quickly.
Oh, I didn't know you were going to call me first. Final thoughts. I think what I'll just say is, and this is to my panelists and both to listeners, I think we're in very interesting times, right? And what I've always encouraged people to do is to lean into the change, to be curious about it, like if you can go to the deepest end and jump in, right? You will make the best out of it. There's so much that can be done. Don't even think that you are too far from it. Like, you can literally build your own AI, right? When I saw the recruitment AI this morning, the other one, I was like, I could have built this one. Lean into it. Don't even hold yourself back with the things that are happening. And with the federal government, I think from last year when they released the whole thing around digital healthcare, it also tells us that there's going to be a lot of opportunities in the future. So now is the best time to be able to do things like around training, even to the school, to begin to look for it, because we still have that skill gap. And I'm talking of in the broad category. So even as a HR person, you can begin to think of, with everything you've learned, how you can train people, what you can do, with everything you know, how you can help other people, but just being in and enjoy the times that we're in.
Thank you. Tiyeyosi, quickly, very quickly, please.
Okay, so thank you so much for having me. What I would just say is that the world of work has changed, and it has changed, and it has changed, and it has changed. And it is those that push and persevere that would equally be able to make it. So things that we know has changed, and we need to be able to expand our horizon. Anything you think of can happen. Anything you think of in this world now as it is can happen. So we need, as HR people and as people, to say that things are going to be changing. There'll be a lot of disruption. We need to be prepared for it. And we ourselves need to go to the front. And let's not think that HR cannot be replaced, people cannot be replaced. You can be replaced, honestly. So maybe that fear in us, or just having that chat, will make us think of things very differently.
Thank you. Olakunle, very quickly.
All right. Thank you very much. I will say that it's very obvious now that HR plays a very critical role when it comes to adoption of technology. And just like what Tiyeyosi just said, things will keep changing, and we also need to change along with it so that we can then balance people's strategy with technology and make best use of it in our respective organization and sectors. Thank you.
Thank you. Adeswa, very quickly.
All right, thank you, Vivian. Just to say that, as HR people, we always talk about building a future-ready workforce. Just to say the future is now, the future is here. So while we always think about building people for the future, we have to look at now. And I'll just say people should embrace technology. People should look for how to make things easier and work for staff. So as HR heads and HR professionals, we need to begin to embrace technology and think of how we can begin to work smarter and make our lives easier, because automation has come to stay, artificial intelligence is here to stay, ChatGPT, these things, we have to become very conversant with them and then begin to see the benefits. It's only when we begin to see and embrace it that we can actually cascade it down to staff. Thank you.
Thank you very much. Timothy.
Yeah, thank you, Vivian. Thank you, panelists. I want to say that nothing is in its final state. Absolutely nothing is in its final state. Everything keeps evolving. So let's open our mind to the evolution in our world. Let's keep up. I know sometimes it can be difficult to keep up, but let's keep up. We might come from different backgrounds. We might decide that we want to retire in HR, but really let's keep up with every digital transformation that is happening out there. And also let's be champions ourselves of all these developments in AI and tech space. Thank you.
Thank you very much to our panelists. We're truly grateful. And this is on a lighter note, very quickly. Same goes to you, Timothy. If you were to choose between skydiving and swimming in the deep blue sea, what would you choose?
Skydiving. Skydiving.
Really?
Yeah.
Okay.
I don't have to think about it.
And this one, what would you choose?
Skydiving.
Wow. TLC, what would you choose?
Skydiving?
I'm coming to the why. TLC, what would you choose?
I think swimming. Swimming. I'm not sure about sky. Maybe I don't know. I'll do skydiving.
Okay. Olakule.
The answer is straightforward, though. Skydiving. I'm afraid of water.
Okay, last but not the least, Ijoma.
Skydiving, man.
Wow, everybody has chosen skydiving. Nice.
You land now, at least you land. End up on land, so skydiving.
Great. Thank you very, very much, everyone. And this is all for today. And we look forward to seeing you again. Have a great day. Thank you. Bye-bye. That'll be all.
Thank you.